Hi. So today we will discuss about the physical signs in appendicitis. So it's always important for a clinician to develop the clinical skills which will help in diagnosing and management of the patients. So today we discuss the physical signs of appendicitis. The first physical sign I want to elicit today is McBurney's sign. I think all of you know the McBurney's point with regards to the appendix. So if you make a line between the anterior superior iliac spine and the umbilicus, if you take medial 2/3 and the lateral 1/3, the point between medial 2/3 and the lateral 1/3 is the McBurney's point. So McBurney's sign is when we examine the abdomen in a suspected patient of appendicitis, compared to the rest of the abdomen, you will get the maximum tenderness at the McBurney's site. So when I'm pressing, yes, severe pain at the McBurney's point. That is the McBurney's sign. We will move on to the next physical sign in appendicitis, which is Blumberg sign. As I told you before, the McBurney's point. So when we press deep at the McBurney's point, make sure that you look at the patient's face, not to cause severe pain to the patient, and at the maximum discomfort to the patient you stop. Then suddenly you release your hand. You notice that the increase of the pain or the tenderness. So that is the Blumberg sign, and which is called the rebound tenderness as well. Okay, the third physical sign is Dunphy's sign. Here we ask the patient to cough and inspect. So can you cough, Roshi? Any pain anywhere? Yeah. Okay. So maximal tenderness at the right lower quadrant over the McBurney's point. That is called Dunphy's sign. When you ask the patient to cough or sneeze, that will increase the intra-abdominal pressure, which will exaggerate the pain because of the maximal inflammation at the right lower quadrant, McBurney's point. That is called Dunphy's sign. Okay, we'll move on to the next physical sign, which is the Rovsing sign. So like I mentioned you, the McBurney's point at the right iliac fossa, parallel place at the left iliac fossa. When you examine the abdomen, when you press at the left iliac fossa deep, where did you get the pain most, Roshi? On the right side. Okay. So when you press deep at the left iliac fossa, patient is complaining more pain at the right iliac fossa, which is due to the referred pain, and that physical sign is called Rovsing sign. Okay, let's move on to the next physical sign of appendicitis, which is the Psoas sign. So as you all know, the appendix has different sides: retrocecal, pre-ileal, post-ileal, or maybe the pelvic appendix. So in case of pelvic appendix is lying at the pelvis over the psoas muscle. So in appendicitis, inflammation of the appendix causing some irritation at the psoas muscle. So here in the psoas sign, what we do is we stretch the psoas muscle, which will cause exaggeration of the pain due to the inflamed appendix at the right lower abdomen. So this can be done in two ways. The first method is passive extension of the psoas muscle. Okay, Goshi, can you turn to the left side, please? So patient is in the left lateral position, the straight lower limb. You extend the hip, right hip, and which will cause increased pain and pain at the right lower abdomen, where the inflamed appendix is lying. Okay. Can you lie supine again? The next method is the patient is lying supine, and we ask the patient to flex the right hip against your resistance. Goshi, can you flex your right hip? Yes. Where do you get the pain most? Okay. So again, flexion of the right hip against resistance will cause increased pain at the right lower abdomen. That is again suggestive of appendicitis because of the positive Psoas sign. Okay, the last physical sign in appendicitis to elicit is Obturator sign. As you know, the obturator internus muscle is another pelvic muscle, So because of the inflammation of the appendix causing irritation to the obturator internus muscle, we'll stretch the obturator internus muscle and look at the patient's response. So this we can do by flexing the right knee and the hip and internal rotation of the right hip. Where do you get the pain most? The right lower abdomen. Okay. So that internal rotation of the right hip will cause exaggeration of the pain at the right lower abdomen, which is again suggestive of appendicitis. That is the obturator sign. So I think we have discussed about the physical signs of appendicitis. It is very important as clinicians, especially in the third world country. So the importance of physical signs, we can avoid unnecessary investigations. As you all know, today we can do a CT scan which is more sensitive for appendicitis in an adult. But there are situations you can't do CT scans. Maybe because of the cost of the procedure, and maybe CT scan is not available. And the other thing is risk to the patient, radiation. And some other young patients, reproductive age, we have to consider about the risk of radiation as well. So if you master your physical signs, you can avoid unnecessary investigations. I hope you enjoyed the video and learned something and master your physical signs. Thank you.